Hello everybody, my name is Mpho Shakes Raesi. I come from the village called Saroe, where I did all my basic education, and then I graduated with Bachelor of Nursing Science at University of Botswana in 2004. I also did a postgraduate diploma in HIV/AIDS management with Stellenbosch University in 2018. I joined Botswana Harvard AIDS Institute Partnership in 2007, having worked for about 2 years in Princess Marina as a registered nurse. Yeah, so I joined under the Kotlana study, for which I did 3 years, and then in 2010 I joined a clinical trials unit, which was looking at ACTG and impact networks. I also joined, at the time I was a senior research nurse, and then same year I was promoted to head research nurse up to 2013, and then there was an office of quality assurance that was created at the time, and I was roped in to man the office up to 2020 as a quality assurance coordinator. And then 2020 up to now, I was promoted to coordinate impact network studies and also to oversee Molepolole research site as a CRS coordinator. So as a study coordinator for impact network, my responsibilities is to oversee the conduct of the protocols that are conducted under impact. So currently we are conducting about 4 protocols or studies, of which 2 have study participants and 2 don't have participants. So our anchor study is Impact 2017, so where we are looking at giving long-acting injectable ARVs. So this is one of the studies that was initially done in the US, and then later it was brought to international sites, and then we were roped in. And so currently we have enrolled about 25 participants in that study across Molepolole and Gaborone sites, and the participants are doing well on the long-acting injectable ARVs, being cabotegravir and rilpivirine. Yeah, and then another study is P1093. So this is a study where we are looking at children who were failing their first line ART regimen, and then we added dolutegravir, DTG. So at the time it was not available under the government guidelines. So we enrolled about 5 participants, which all of them did well. So the study is coming to an end, and so since now the government is giving out DTG, so all our participants has been transferred or will be transferred to local standard of care to continue this DTG based ARVs. And then the 2 studies that don't have participants is Impact 2005, so where we are looking at children who have MDR-TB less than 18 years of age. So we want to test the drug called dilamanid, adding it to their optimized background therapy to see if it will have effect on treating MDR-TB in children. So currently we don't have any participant enrolled in that study. And then the another study is Impact 2026. So this is where we are looking at women who are pregnant and have TB, so also either living with HIV or not. So but also currently we don't have any participants enrolled into that study, but our team is on the ground trying to look for potential participants, to enroll into that study. Yeah, so, and we also have upcoming studies that we'll conduct soon during this year. So there are about 3, IMPACT 2028, IMPACT 2036, and also IMPACT 2016. Yeah, so my future goals is to see myself as a data analyst at some point in the research field. Yeah, so also I'm currently working on a small project that will be looking at, the acceptability and tolerability of, long-acting injectables in, adolescents. Also their caregivers. So we want to see how the perceptions and how they our small cohort have accepted this long-acting ARVs, and how they have changed their lives. So I'm working currently with Dr. Mashetu and Dr. Shaheen on the protocol. So soon it will kick start. So it's the qualitative part of IMPACT 2017, which was only done in the US. So we want to see if the data that we will collect will be comparable to the data that was collected in the US. Yeah. So my last words will be, I pray that at one day we'll have eradicated HIV and found HIV cure. So through that, I will urge all my research colleagues to embark on ethically conducted sound research. So where putting integrity of whatever that they're doing first, and also taking care of participants, because without participants participating in our studies, so we will not achieve our goals of ending HIV/AIDS. Thank you.